委員，咁我哋而家有足夠嘅。
Members, it's the appointed time and we have a quorum. Item 1. Since the last meeting, no information paper was issued by the Secretariat. Item 2. Items for discussion at the next meeting. Let's first invite the administration in. Items for discussion at the next meeting. The administration proposes the discussion of genomic medicine. The date of the next meeting will be the 12th of June, which is a Friday at 10:45 a.m. Members may refer to the list of outstanding items for discussion, and recommendations are welcome. At the last meeting, Ms. Elizabeth Quad proposed the discussion of the breast cancer screening program report, but since the government has focused its work on epidemic control recently, this item could not be discussed at the meeting today. The Secretariat are working with the government to see if the item can be discussed at the next meeting. This is an item of much interest, so hopefully it can be discussed in June. Item number 3. Measures for the prevention and control of coronavirus disease 2019 in Hong Kong. Members raised questions last time, including Mrs. Regina Yip, Dr. K. Kwok, and Mr. Ray Chan. And relevant officials are in attendance today. However, some representatives are unable to attend. With us today, we have Professor Sophia Chan, Secretary for Food and Health, Ms. Leonie Lee, Dr. Wong Ka-heng from the Department of Health, Dr. K.L. Chung from the Hospital Authority, Dr. Ian Chung from the HA, Ms. Leona Law from the CDB, Ms. Cynthia Chan from the Education Bureau, and Mr. Alex Wong from the Social Welfare Department. We first invite Professor Sophia Chan to walk us through the paper. Thank you. Good morning. Since the outbreak of the coronavirus disease 2019, the government has been monitoring the development of the epidemic locally and overseas, and we have taken appropriate and decisive action. Recently, the number of new confirmed cases in Hong Kong has declined, and since the 12th of April, the number of newly confirmed cases daily remained at single digits, and there was 0 new confirmed case in 11 of the days. But when we look at a number of countries and regions, the pandemic is still severe. And in terms of our epidemic control strategy, we must continue to prevent the import of cases, and we must control community transmission. The government continues to observe stringent immigration and quarantine arrangements. For inbound visitors who are not Hong Kong residents, they would be denied entry or transit. Apart from exempted individuals, all inbound visitors must undergo compulsory quarantine. In terms of enhanced surveillance for visitors returning to Hong Kong via the airport, deep throat saliva specimens would be collected, and they must wait for the results before they can return to their place of quarantine. Specimen bottles would be distributed, and this would facilitate early detection, treatment, and this is essential to disease prevention and control. In terms of minimizing social distancing, we will continue to observe the suppress and lift strategy. And according to CAP 599F, that is the Prevention and Control of Disease Requirement and Directions, Business and Premises, and CAP 599G on prohibition on group gathering, social distancing measures have been relaxed. These measures will be effective from today for 14 days. As for catering businesses, scheduled premises, and prohibition of gatherings, certain measures have been relaxed. And for catering businesses, the number of customers per table is relaxed from 4 to 8 maximum. And for places of public entertainment, massage parlors, beauty parlors, and Tinkao parlors, they can resume operation, and clubhouses can reopen as well, but they must observe certain measures. Other scheduled premises include karaoke, lounges, nightclubs, etc. They must remain closed for 14 days till the 21st of May. Under 599G, prohibition on group gathering would be relaxed. The number of members is relaxed from 4 to 8, and the exemption would also be relaxed. And according to 599F, the allowed group gatherings would not be subject to the restrictions under 599F. Since the pandemic in Hong Kong has somewhat eased, we must remain vigilant in order to uphold our efforts. I urge the public to continue to observe the two regulations, and the relevant businesses should comply with relevant requirements. The government also urges the public to observe personal and environmental hygiene. Myself and my team are happy to answer questions of members. Thank you, Secretary. The floor is now open for questions. 9 members are waiting to speak. Michael Tian, Chen Puyin, Tommy Chang, Siu Ka Fai, Pun Siu Ping, Siu Ka Chun, Rebecca Chan, Chen Han Pen. A total of 10 members. 4 minutes each. Mr. Tian. Thank you. Secretary, the group gathering prohibitions would be relaxed starting from today, and 8 customers are allowed per table. Whether you relax it further to 12 persons or otherwise, on the 3rd of May, I suggested apart from completely lifting the gathering restriction, people must be mandated to wear masks on certain occasions. For example, church gatherings. There are relevant measures in the Czech Republic and Austria, and in Germany, there is a requirement for people to wear masks on public transport and in supermarkets. And in school campuses, visitors, teachers, and students are asked to wear masks. Apparently, for certain places, no speaking is involved. For example, cinemas, then no masks are required. But for activities that involve singing or speaking, masks must be worn. Would the government adopt such measure? If that's the case, many people would have to stock up on masks, even though you have offered to distribute reusable masks. Secretary, thank you. In terms of the current situation, we have started to relax certain social distancing measures. As we relax these measures, we must continue to observe certain public health measures, including the wearing of masks. For certain activities, wearing of masks is not possible. For example, when people are drinking or eating, but when they finish eating or drinking, they would be asked to put on the mask again. So in the coming future, we still recommend the wearing of masks. Well, this is not about offering recommendations or advice. What I say is when the measures or restrictions are lifted, would you legislate for the wearing of masks in certain situations? When we look at the behavior of Hong Kong citizens, I believe more than 90% are wearing masks already. So at this stage, we don't see any need to legislate for it. Even after the gathering prohibitions are lifted in the future, we will strongly recommend the wearing of masks. We saw that the citizens have been very disciplined so far, so you should be very careful on this. Can I ask another question? Currently, exemptions are given for business travelers or cross-boundary school children, and some people have questions on who would be offered exemption. For those from the mainland, health certification is needed. You can gradually relax it from 3 days to 7 days to 14 days. That should be the right way to do so. That way, you would hear less doubts about who are eligible for exemptions.
Well, under Cap 599C, we have already increased the number of types of people who will be exempted, and the relevant policy bureaus are working together. And for those who are doing factory business and so on, so that's under the ambit of the CEDB, and they'll consider whether or not they should be exempted, and they would also have to make an application. So that's the mechanism. And if necessary, we will, of course, take a look at the tests and other measures that will have to be incorporated so that they would have to comply. But then from the health perspective, what's your view? So from the health perspective, what's your take on this? Well, you have already overrun, so please give her the floor to answer the questions. Well, under the exemption mechanism, when they come back to Hong Kong, they would also be subject to medical surveillance. Yes, next. Well, as you can see, I'd like to publicly thank the Hong Kong people because they've been working together, and we can safely say that some 99% of them are wearing masks voluntarily. That's why at 3 levels, people are willing to wear a mask, and they're taking or paying attention to personal hygiene and environmental hygiene. And then at hospital level, we have sufficient number of hospital beds, and we have also done enough tests. And also at the government level, you have been doing a good job in terms of surveillance, and there is no exemption whatsoever. And you've been doing a lot of testing and tracking and so on. So fighting the pandemic is very simple. It's about the guidelines, and I think we have already got very good guidelines in the days of the SARS outbreak. All right, coming back to the issue of the face mask. All right, it's about the reusable mask. Well, you're wearing masks, and we are using disposable one-off surgical masks. What if I encounter or come across somebody who has got droplets and so on? Well, when we wear disposable one-off surgical masks, we will dispose of it right away. But then for this reusable mask, if the circumstances remain the same, and if there are droplets and so on, and coronavirus on the surface of it, how are you going to disinfect it? How are you going to sanitize it? Because there is no specifications and also directions to use on the cover of the plastic bag. Okay, so if there are virus, coronavirus, and also other droplets left on the surface of the mask, then how are we going to sanitize it so that we will not be infected with the virus and other virus or bacteria? Dr. Chen? Well, for these reusable masks, they are not for surgical use or for medical use. They are just for general use, and therefore, when you go to the hospital or when you are in medical institutions, you'd be advised to use appropriate masks, for example, other than the one-off surgical mask or N95. There are other protective gear available. All right. For the mask that we are wearing for the purpose of fighting the pandemic, so if it's not a surgical mask, then, for example, when we are just walking on the street, then if we are not wearing the mask for medical purposes, then why are we wearing masks? Is it for the purpose of covering our face? All right, we have already called upon other colleagues to come back to answer the questions. Well, given the fact that she's from the Food and Health Bureau, so I'll directly ask the question. So at your meetings and also for the internal meetings of the government's senior management, so what is happening with this reusable face mask? If it's not for medical purposes, then what is it for? Okay, I'll ask the CHP to give you more details about sanitization of face masks. So is it Dr. Wong Kah-heng? Okay, Dr. Wong. Thank you, Madam Chair. Thank you, Dr. Chen. Well, the Department of Health has not been involved in the manufacturing of the reusable masks. So the DOH has not been involved in the development of the reusable masks. And therefore, we are not too sure about it. Okay, he has answered the question. Well, Bureau Director, I've repeatedly said this last time. Okay, you have the responsibility at the senior management of the administration. So you will have to clarify or sort out what is happening. So if this reusable mask is not for medical purposes, and you said that you were not involved and therefore you had nothing to do with it. Okay, in fighting the pandemic and also in terms of immigration control, all right, if there is a pilot flying to the US and then he comes back to Hong Kong and at the time of entry, and if there is an exemption and there is no test whatsoever, then they themselves would be very afraid of that. So, okay, in the US, the situation is already very serious, and therefore by the time when they come back, if there is no test whatsoever and they can walk around in the streets, then what is happening? So you're suggesting that these people should be subject to tests, right? Yes, we are not trying to criticize you. We just want you to do a better job. Because they would also be landing in Hong Kong and they would also coming to downtown and so on. So what are we going to do with them? Okay, I'll ask the CHP to look at the port health situation. Okay, CHP. Dr. Wong. We only have Dr. Wong from the CHP here. Okay, so would you consider stepping up control or surveillance on those who have to frequently fly to overseas countries? Well, on those exempted types of persons, yes, there is an exemption arrangement, but then we do encourage them to give us deep throat swabs for testing. So that's one point. On surveillance. So we will also be doing this sort of surveillance. Okay, as you can see, if you look at the local infection case, there is none. And we've been doing a remarkable job. So the most important thing is for us to guard our own gate so that for people coming back, we are all very afraid of that. And therefore, I think it's a very good suggestion by Dr. Piers Chen. So please consider it. Next, Tommy Zhang. Thank you, Madam Chair. I'm not sure if my mic has been switched on. Yes, it's on. Okay, Bureau Director, just now I really agree with some of my colleagues, but then on this occasion, when we are fighting the pandemic, I think the administration and also the general public, including many of us from the trade, we've been working very hard to fight the pandemic, and we've been doing a remarkable job. In particular, colleagues are trying to organize strikes, and even for those medical staff who were on strike, they've been doing a very good job, and therefore I'd like to extend my gratitude to them. Well, yesterday, Bureau Director, thank you very much, because out of your very busy schedule, you spare some time to meet with some of our representatives from the sector. So who are they? Well, they hold karaoke licenses, and of course there are catering establishment licenses and so on. And of course there are, if they have a karaoke endorsement on their restaurant license, then they will have to do a lot more in terms of fire safety. But then some of them are just allowing people, including their friends, to enjoy food and to have some drinks, and then to sing, to play with karaoke. And then there are also entertainment establishments where food would be served, and alcoholic drinks can also be served. And from time to time, patrons would also sing karaoke. But then on other occasions, they might not be doing that. But then when they can see that for bar and pub businesses, they've been allowed to reopen, and yesterday they tried to meet you, and they hope that the administration would consider relaxing some of the regulations, because for those working at karaokes, they would be willing to comply with what you're imposing on karaokes, on bars and so on. For example, only 4 people at a table, and the distance should be 1.5 meters from one another, and they would only be allowed to take off their masks when they are consuming food, and there would be no dancing whatsoever, and there would be no live bands. And of course, there would only be background music. So even at karaokes, they would have some background music, but then they would not be given microphones to sing. So there is no question of them being involved in singing in these establishments, and of course, no dancing would be allowed. So these are entertainment establishments. So under those circumstances, Bureau Director, they'd be willing to give up on what you are concerned most, that is because the act of singing might render the place pretty risky, because they might be there for a long time, and they might be exchanging droplets and so on. And that's why you came up with this risk assessment. But then during this short period of time, before you completely lift up the restriction so that they would not be allowed to sing, but then they'll be willing to put up a sign saying that for the normal singing business, we are no longer allowed to do it, and we will only be providing or serving food. So that's the regular catering business. So would you be willing to allow them to resume the business like their counterparts are in the pubs and bar business? So is it possible? Bureau Director, thank you. According to our earlier guidelines, there are 4 types of establishments that have to be closed, including karaoke establishment, place of entertainment, and so on and so forth, and massage bath parlors and bathhouse and so on. So for these premises, before they close those establishments, that is before the publication of these notices, if they already hold more than 1 endorsement, and if the operator has already taken effective measures to prevent the spread of the disease, and they have already stopped the provision of such services in their premises, then the premises will be allowed to continue to operate other licensed businesses that have not been closed by the administration. For example, Mr. Tommy Cheung, you also referred to certain businesses, and we have also already sought legal advice from the DFJ. For example, if they are running karaoke or catering businesses, and if they are willing to cease the operation of karaoke businesses, and if they have already stopped or closed the facilities for karaoke operations, for example, the equipment and so on has been closed, and they're willing to put up conspicuous notices in their premises stating that their establishments will only be providing catering business or services without karaoke operations, then they will be allowed to continue to run their business. But of course, in running their catering business, it's like pub business, or they would also have to comply with the relevant instructions with regard to how their businesses should be run. Yes, Mr. Shiu Ka-fai, I have several questions. First is about the sauna houses. Okay, for massage parlors, they are allowed to resume business, but then for sauna businesses, they are not allowed to run their businesses. They've already stopped their businesses for 3 times 14 days. And, well, in some cases, they would also offer massage services. And for sauna houses, they are also offering massage businesses. The difference is that they would have a cold water pool and also some sauna rooms using vapor to heat up the room. Okay, for these pools, they are willing to close them. And also for those dry and wet saunas, because you're concerned about the aerosols, and therefore they are willing to close that. So if they can close all those, then there is no difference between them and the beauty parlors. So long as they are willing to close those sauna business, they should be allowed to reopen. And for fitness rooms, okay, you already allow them to resume business. But then if they are offering dancing classes and so on, and if it's restricted to a class of 8, then there are big problems, because in the past, instructors might be teaching, well, individual instructors might be teaching several dozen trainees and so on. And if you do not allow them to have bigger classes, they may have to close down. So sometimes they may have a studio of several thousand square feet, and it's very big. And if it's restricted to 8, it's not reasonable. I've also talked to your colleagues, for example. Let's say if there are 32 people, because under the current rule, if they have groups of 8, then if they are located in separate locations, and if there is a distance of 1.5 meters, then what's wrong with that? And also, if there is a group learning bicycles, one is learning rope jumping and so on, that's not a problem. But then if 4 classes are taking a yoga class together, then that's a problem. I don't understand it.
There are people exercising. Why can't yoga instructors be allowed to hold classes in four groups? We can have a group of people cycling, a group doing yoga, so long as they maintain a 1.5 meter separation. You are subsidizing the beauty and barber trades. I welcome the move. But your policy is based on the staff size, and they must be making MPF contributions. In the barber and beauty salons, many people are self-employed without making MPF contributions. And sometimes single mothers would work part-time at these salons. Many businesses will only enjoy a subsidy of $30,000, which is not even enough to cover rents. Apart from offering subsidies based on the staff size, you should consider the size of the establishments or venues. The SMEs hope that the applications or subsidies would be based on the size of the venue, so that bigger venues can get more than $30,000. The current practice is not fair. For many tuition schools, they should be allowed to reopen. You can impose restrictions on these tutorial centers, or else a lot of people would be out of a job. I hope you would allow them to reopen. Can they answer my questions? Well, I asked at least 3 questions. Well, you spent 4 minutes already. Secretary, please offer a quick response. The first question was about bathhouses and saunas. Currently, the bathhouses must remain closed. They feature pools, steam pools, or sauna facilities. And I hope Mr. Xu understands that the mist, steam, and these would become media for transmitting the virus. That's why they must remain closed for the time being. For premises that offer massage services, and if they are licensed, we would have to consult the DOJ on what their main operation is, whether it is a bathhouse or a massage parlor. Secretary, the weather is getting very, very hot, and we still have to put on masks. As for the limitation of 8 customers according to our order, for fitness centers, each group or class must have no more than 8 persons, including the coach. The Home Affairs Bureau has arrived at this decision after consulting the trade. As to how the anti-epidemic fund subsidies are to be dispersed to the beauty sector, I would convey these views to the Chief Secretary. Your time is up. The Home Affairs Bureau never consulted these establishments, and many fitness centers are going to be out of business. I know these are questions many members would like to learn about. That's why I allowed the Secretary to respond. But I hope from now members would allow time for officials to respond. Professor Joseph Lee. In February or March, and we said that certain people were infected by the pneumonia virus. And according to, and we asked whether this, whether COVID-19 would be classified as an occupational disease. The government did not learn their lesson from SARS. So my first question is, what has the government done in this regard? We have more than 1,000 confirmed cases. These patients are reluctant victims. They were admitted to hospital, and some were discharged, but many of them still remain hospitalized. So these are the forgotten group. The frontline healthcare workers are working very hard for them, but many people who were discharged have been ignored. Recently, and a financial aid has been distributed. So for discharged patients, they need all kinds of support, including mental and financial. Looking back at SARS 17 years ago, the government invested in a $130 million trust to help SARS recoveries. But this time you are not doing anything. You are supporting businesses, but the government has forgotten about these recovered patients. And is there something the government should do in this regard? And as the pandemic eases, restrictions on various businesses have been relaxed. There are about 27,000 cross-boundary school children. And apparently the restriction would be relaxed and secondary schools would resume very soon. In terms of these cross-boundary school children, does the FHB have policies in place to ensure the safety of these school children in Hong Kong? We have not heard anything by way of policy. in terms of businesses, well, I criticize the hospital authority of maladministration. They are offering a special allowance, but some healthcare workers receive it, some don't. So this is really chaotic. And if I'm working in the dirty team, but if I'm a civil servant instead of a member of the HA, I'm not entitled to the allowance. We wrote multiple letters, and the government was shoving us around. In terms of allied health staff and laboratory staff, they are at high risk, and yet they are not entitled to an allowance. Yet the HA headquarters says the staff should be entitled, but the actual enforcement of the policy is really confusing. Thank you. First of all, I will defer the last question to the HA. In terms of the classification as an occupational disease, I understand the Labor and Welfare Bureau are working on this, and we remain supportive. As for discharged patients and support for them, there are two areas. One, I would defer to the HA, and at the Kwai Ching District Health Center, we are working with the HA to design support services for discharged patients, and the services will begin very soon. These include the disease analysis, disease control, mental support, nutritional information for discharged patients, anti-epidemic drugs, and how patients can rebuild their lives, and the work will begin in due course. In terms of the cross-boundary school children, I would defer to the Education Bureau. As we understand, classes are yet to resume, and at this stage, the school children would not be arriving in Hong Kong. Once classes resume, the Education Bureau would discuss the relevant risks with the Department of Health before they decide on the class resumption details, and in the joint epidemic control measure with the mainland, we would seek to assess the situation. If school children who return to the mainland must receive a 14-day quarantine, that would not be conducive to their education. So I believe this is something the EDB would discuss with mainland authorities. Perhaps the HA can explain how they would follow up on the 900-odd discharged patients. For discharged patients, we have always supported, provided support services. In terms of policy, we would complement various funds and for patients with financial difficulties, we would refer them to social workers. As for the special allowance for staff at risk, and in terms of work type, the duties of different staff members are indeed complicated, but our main criterion is whether the staff engage in high-risk work, and this applies to laboratory staff as well. For example, some would deal with work related to COVID-19 testing, and we are talking about a substantial amount of staff. That's why the HR department offers a hotline 52757500, and WhatsApp service is also available. Hopefully this can address the queries of the staff. Professor Lee talked about recovered patients. We have a separate program in place. which is a Chinese medicine outpatient program. This is a special program. It was launched on the 24th of April, and it is designed for patients recovered from COVID-19, and for the first 6 months after discharge, a maximum of 10 Chinese medicine outpatient services would be provided. For patients who test positive again, would you follow up on these patients? As for the patients who were tested positive again under the PCR test, but these come under different categories. For those who have visited the doctor again, but nothing was found abnormal, they would not be tested again. This is our view. For patients who have recovered, for the residual virus or residual RNA, they are not alive. Our tests are very accurate and sensitive, so they would be tested regularly. If they have symptoms, then tests will be carried out again. In some cases, their family members or employers might be concerned, so they would receive tests outside again. Next, Mr. Yu Si-weng. Thank you.
Well, during the last couple of months, because of the pandemic, the administration came up with a series of measures, and a lot of the commercial activities have been halted, whether it's immigration, going out, and also retail, and also inbound tourism. They have all ceased operations. And yesterday, we've been told that we cannot close our door forever. And we will have to look at the situation with regard to the epidemic, and we will have to reopen our doors to business. And we will also have to consider relaxing the immigration control for places where the pandemic has been under control, so that the relevant trades will be able to breathe some new air, some fresh air, so that they can survive. All right, it's been 18 days since we last have a local infection case, and in Macau, it's been 28 days, and then Shenzhen 30 days, and then Zhuhai 40 days. So they are already raising this proposal of tourism bubble. That is in places where the situation has eased off. Then we can reopen the door to one another on a limited basis. I think it's appropriate time for us to look into this, the concept of or the idea of tourism bubbles or travel bubbles. So first of all, on the ban on group gatherings, we have already lifted that so that up to 8 people would be allowed to enjoy their meals together. All right, after that has been relaxed, people will be more rest assured, and then they can come out to consume again. And even Ocean Park is considering reopening, but then because of the ban, they have not opened to the public. So given the situation, will you come up with a standard as to when they can completely reopen instead of having this ban on group gatherings, and also for cross-boundary travel bubble? All right, we have looked at several places, including Shenzhen, Macau, and Zhuhai. When compared to Hong Kong, their situation is even better. So they've been doing an even better job, because the number of days of no local infection is even longer than that in Hong Kong. So when will you be prepared to consider adopting this two-way approach when it comes to travel, so that Hong Kong can gradually be back to normal? Bureau Director, thank you, Mr. Yu, for your questions. In fact, overall speaking, the Chief Executive has repeatedly said that on the one hand, we have to look at public health risks, and at the same time, we also have to not just look at public health risks, but also the overall economic development, and also the way the public can cope with the situation. As you have rightly pointed out, we have gradually relaxed some of the measures on social distancing. And of course, we have to do the appropriate thing at the right time, because the situation might have eased off a little bit. But then just yesterday, we had 4 imported cases. So the most important thing for us is that, when it comes to imported cases, we will have to stop them. And even within the local community, we would also have to prevent the spread of the disease, and also we will have to cut the infection chain. We do understand the overall situation, and we will have to monitor the situation closely before taking action. And then we will decide as to when we can gradually relax those measures stage by stage. You refer to the several places on the mainland. For example, earlier on, under Cap 599C, we have extended that by 1 month until the 7th of June. And at this juncture, we are of course monitoring closely, and we are actively pursuing this with the mainland authorities, for example, the Guangdong province and also Guangdong province, to see how we can do tests in a collaborated manner. For example, we have already increased the number of types of people who can enjoy exemptions for testing and so on. And we're also coming up with an exemption mechanism together with the relevant authorities. It's not complete relaxation. So we are doing this stage by stage. So we'll be monitoring the situation closely, so that on the basis that we try to resume our life back to normal, but then I will be very cautious. So, would it be put on the agenda of fighting the epidemic? All right, we are already at this stage. Other than deepening our existing work, for example, our testing, how we able to expand it even further, and then we must also do appropriate tracking. And then when it comes to other measures, they are also they have to cope with the current situation. We have to relax where there is a need, and so on. And that's a very important part of our work right now. Next, Mr. Poon Siu Ping. Thank you, Madam Chair. Before the vaccine is available, the public of Hong Kong will have to wear a mask for the prevention of the spread of the disease, in particular when they are taking public transport. Well, this morning, when I took public transport, it was already quite crowded, and I can see that schools will resume classes, and the epidemic situation has eased off quite a bit, and I think the measures have seen some effect. And of course, I understand that when it comes to disease prevention, most of the cases right now are imported cases. That's why immigration control is very important. And just now, a member also referred to a situation, and we will have to consider that, because for different countries, the current state of affairs is very different, and therefore we will have to adjust our immigration control accordingly. For example, just now the Bureau Director already shared with us her thoughts. So I'd like to take this opportunity to say this, because according to the paper, by the 7th of May, we have already got 1,045 confirmed cases. One is a suspected case. And in the past, for suspected cases, would they be incorporated? And we had 4 deaths. So 943 already discharged. In other words, there are still 102 who are still in hospital. So for the 900 plus patients who have recovered, so what kind of treatment did they receive at the hospital, and what kind of drugs have been administered on them? So do you have the information to share with us? So is it that so long as they stay in a hospital and then for a while they recover by themselves without any medication, or what? And then at the hospital level, in terms of the central store of PPE, I'd like to know the situation, because, in fact, despite the fact that the situation has eased off somewhat, the situation is still rather fluid. in terms of personal protective gear and also surgical masks and so on available for frontline healthcare staff. Earlier on, they've been doing a lot of procurement. So have they been able to replenish the supply? And you said that you had 2 months supply. So can we say now that we have got even more available? And also on the facilities. Yes, we have Lei Yu Mun and also Chunyang Estate and so on. And you said that you have 3,700 units available because you're concerned that the situation might change, and therefore in Sai Kung and also Ko Chok Wan, you have also put in place quarantine facilities, and there would also be about 1,600. So altogether, you have 5,300 plus such places. And of course, I don't want the situation to become serious again. So what are the new considerations right now when it comes to quarantine facilities? Also, I'd like to follow up on this because schools are going to resume classes shortly, and we don't want to see another outbreak at schools. Schools, according to experts' opinion, they are making arrangements accordingly. So in the event that there is a school outbreak, then would they be stopping classes right away, and then students would also have to be subjected to quarantine? Bureau Director, thank you for your questions. Number one, you talk about different places with different situations. Indeed, that's the case, because if you look at the mainland, well, the situation has stabilized. But then if you look at some European and the U.S., European countries, and also the U.S., they've got 5-digit growth every day. So the number of cases is still rising in these countries, and therefore we'll be monitoring the situation very closely every day. And then for the discharged patients, I'll defer to the hospital authority. We have over 900 confirmed cases who have already recovered, and they have already been discharged. And also on PPE, I'd also like to invite the HA to answer. And then on schools, I'll defer to the Education Bureau and also the CHP. On quarantine measures, I'll say a few words. Well, as Mr. Poon just said, other than the existing Chunyang Estate and also Yao Zhong Yi Cultural Center and Sai Kung Recreation Center and so on. So we have the Sai Kung Outdoor Recreation Center and also Chok Penny's Bay, and also there are other additional facilities. That is well, for Chunyang Estate, it's not a permanent facility, but then for other facilities, say for some temporary facilities, can they be made permanent so that in the future we can step up our quarantine facilities? I'll defer to the HA. Yes, thank you, Madam Chair. Thank you, Mr. Poon, for your questions. To update you on the figures, but together with the 4 imported cases, we have a total of 1,045 cases, and over 900 have been discharged. And for those who are still in hospital, we have 81 patients only. Overall speaking, Mr. Poon also asked about the use of drugs. Well, right now, well, our infectious disease unit would be looking at the best prescription for our patients. Not every patient will need antiviral drugs. For example, for the younger patients with mild symptoms, some of them do not need antiviral drugs before they can recover. And of course, some patients would also need that. As you might have noticed, for example, Professor Yuen Kwok Yung also said that we had the cocktail treatment, including ACE and also interferon and also ribavirin and so on. So mainly those are the medications that we are using, and the treatment effect has been quite good. But then we will have to look at the evidence-based approach. And then for the newer drugs, for example, for remdesivir, well, we have also made reference to the international studies, and some 30 patients are using those new drugs, and we will have to look at how it develops. So is it that for the serum or plasma medication, is it the best? Well, that's one of the feasible ways out. So from the recovered patients, if they have sufficient number of antibodies, then we can use the plasma taken up from these patients to inject into the patients. So we have already started that study, and you might have noticed that from news, and the initial results have been quite good or promising. So we have already started such studies. And then for medication, of course, we have not relaxed our efforts because our own CEO, Dr. Koh, has been reminding us that we will have to monitor the situation closely and see what's happening in Singapore. And if there is a spike of cases, then we will also have to look at it. And then for PPE, we have not relaxed our efforts. For surgical masks, we have 26 million, and then PPE, 34 million, and then for N95 masks, 4.7 million. So we believe that the source of supply is rather stable. But then the only thing that we are concerned about is N95 masks. We have only 2.3, but then for the smaller size ones, we are still in short supply. And then for suits, we have 4.7 million. So and then for the goggles, for the gas masks and other types of PPE, we are still in short supply. So we are still sourcing them.
Would the Education Bureau also address some of the questions? The member has about 3 minutes, and the government officials should give a succinct reply. If I strictly only allow 4 minutes per session, then government officials would not have time to respond. But I believe members are looking forward to a reply from them. That is why I hope the government officials can offer a reply. Ms. Chan, after the resumption of class, if schools know that teachers or staff are diagnosed, what should they do? Case tracing and investigation would be carried out by the Department of Health, and they would decide whether quarantine or medical surveillance are warranted. We would be given instructions, and the same for schools. We would require schools to comply with the CHP's instructions in enhancing disinfection on campus. The CHP will also offer recommendations to schools as needed, including whether class must be partially suspended. There are 2 scenarios under which schools must notify CHP immediately. First, members of staff having COVID-19 or people classified as close contacts of COVID-19 that would need to undergo surveillance or quarantine. Mr. Chiu Ka-chun. Mr. Poon Siu-ping asked the Education Bureau whether there would be a 14-day quarantine when there's a confirmed case. So if there is a confirmed case after resumption of class, would a 14-day quarantine be needed for the CU Mask Plus? For Dr. Ho Pak Leung, the head of the infectious diseases in HAU, they said the masks are not suitable for 4 types of person. 1, those with fever or respiratory tract symptoms. 2, confirmed patients, those on quarantine and suspected cases. 3, close contacts. 4, those who need to visit clinics, hospitals, and elderly homes. Since the masks are not appropriate for these people, then who are these designed for? Are the masks designed for people who don't need to wear them? I hope Dr. Wong Kah-heng can explain or comment on Dr. Ho's claim. Just now, you said you were not involved in discussions for CU Mask Plus. Dr. Pierre Chan asked how the mask can be disinfected. You did not offer a reply. I hope. Well, I wonder whether you can explain whether or how the mask can be explained. And is your view in line with that of Dr. Ho? Today, the SWD has a representative, so I have a question for them. Since the 29th of January, almost all centers for PWDs and elderly have suspended daytime services. For the frail and elderly, as well as PWDs, their health has been affected as a result. That's why at the last meeting, I asked about the lack of shower services, and is the onus now on the service providers to resume service? Are you providing enough PPEs to service providers, including coverall suits, face masks, goggles, and shoes lips? So don't just talk about face masks. Do you have enough supplies? When service was suspended, a lot of elderly people stayed at home for long periods. There was no socialization, and an elderly association conducted a study. They were in touch with 20,000 elderly persons, and the number of requests for mental support went up by 70%. About 30% required consultation or counseling. Did the SWD keep statistics on the number of elderly who need emotional support services, especially those who are living alone? Would you enhance such services? Secretary, Mr. Shiu would like to know about emotional counseling. SWD, please. Thank you. In terms of emotional counseling, since the outbreak, our clinical psychology services has been maintained. Those in need can get in reach with the integrated family services unit or our medical social workers. We can offer clinical psychology services. What about the questions about the protective gear and disinfection? In the welfare sector, we are discussing the full resumption of services with the trade. Since the 29th of January, we have extended essential services, including home care services, meal services, drug management services, and other care services. They have been maintained. And with the easing of the pandemic, starting from the 8th of April, with the exception of meal, care, drug management, and clinic visit services, we have enforced other personal support services, including hygiene services and procurement of daily necessities. And for users of urgent and special services, we would gauge the actual needs before providing the required support. Later this month, we would seek to further reinforce the services. In terms of PPE, we are discussing with the trade what should be reinforced. At the same time, we are also consulting the Department of Health, and that is the equipment needed for different types of care services, including the ones mentioned by Mr. Shiu. So we would help reinforce the supplies for the sector. Mr. Chan Pen, with the gathering prohibition order, the public has been cooperative. It shows that with the joint efforts of the public, experts, and government, we can achieve what no one else in the world are able to achieve. the pandemic has eased and we had many days of 0 new confirmed cases, the results did not come easily, and the sectors made a lot of sacrifices. So it is important to be considerate to people around us. As for breaches of the gathering prohibition order, the government must follow up seriously. Earlier, Ms. Tanya Chan took part in a 40-person gathering, and there have been updates to the incident. In previous meetings, we discussed the relevant incident involving Ms. Tanya Chan. She claimed to be a LegCo member, but subsequently we found that LegCo members do not enjoy privileges elsewhere, and she could not hide the fact that there was a 40-person gathering and no one knew whether it was really a meeting or a party. So with these updates, would the government seriously follow up on the relevant case, or would it simply be taken lightly? I hope the Secretary can explain the issue. There were frequent exchange of people between the two places, and at recent times some people would like to visit the mainland for business purposes, but we know there are strict mainland regulations in place, and including a 14-day quarantine, and this would jeopardize business activities between the two places. Has the government explored any measures to gradually open up or allow business activities between the two places again? Many businesses want to visit their factories on the mainland, but they would be subject to a 14-day quarantine upon entering the mainland. Is there a way around this? Thank you very much. The first question was about 599G. For cases that have entered legal proceedings, we would not make comments, but under Cap 599G, we would follow up on breaches seriously. More than 73,000 inspections were made, and we issued more than 11,000 pieces of reminder, and 477 penalty notices were issued as well, and we made 15 prosecutions. For Cap 599C, we added 2 exemption types under the regulation. We can only deal with exemptions on persons who have returned to Hong Kong. As for the 14-day quarantine arrangement of the mainland, under the joint epidemic control mechanism, we are actively exploring whether there could be mutual recognition of test results and quarantine arrangements. The work is underway. Ms. Rebecca Chan, I have a few questions. In light of the current pandemic, the government has relaxed the group gathering restriction, and the number of customers per table has been relaxed from 4 to 8. But as for the preparedness and response plan for the novel infectious disease, we are now at we are still at the emergency response level. Many people complain that they could not visit hospitals to visit patients. And under the preparedness plan, these are infectious that create high risk to the community, and there is evidence showing a chance of continuous community transmission. That is the definition of the emergency response level. So the threat since this threat still remains today, I agree with the Secretary that we should remain vigilant. But having looked at your figures, the number of admitted and discharged patients, most patients were admitted to 15 hospitals, but hospital visits have been prohibited, and we heard a lot of very sad stories. Some elderly patients had to be taken care of by their spouses, while some must be taken care of by their family members, but yet they were all not allowed into the hospitals. We are going to soon we will enter 21 days without any local cases. So can this strategy be adjusted? You can maintain the emergency response level, but in terms of hospital visits, can you be more empathetic? How can you do a better job? Many people need to visit their family members in hospitals. For Chunyang Estate, there are some 4,700 units in 5 blocks. If you do not allow the new population to move in, more than 4,000 households will be affected. For subdivided units in To Kwa Wan and Sham Shui Po, many households are about to move in. Well, I supported the conversion into a quarantine center, but can you at least provide a timeline so that these residents would know when they can move in? A parent told me that they intended to change the school for their children. They are moving from Sham Shui Po or To Kwa Wan to Chunyang Estate, but now you are not providing any timeline. Do you not have any options for quarantine centers? You have Pat Hang, the Sai-Kung Center. You even propose the empty lot at Disneyland. Would you consider vacating Chunyang Estate gradually in order to not affect the would-be residents? Can you provide a timeline when Chunyang Estate would be vacated again?
Third, we are very concerned about this. Yes, the HA has been doing a remarkable job. You've been able to test the patients so that even for the asymptomatic patients, they are still tested positive. So for how long are you going to keep them in hospitals? So for the negative result, for how long? How far in between do you have to have 2 consecutive negative results? So if there is a relapse situation whereby they are tested positive again, so should the interval be a bit farther in between? So, and also wearing face masks, actually Bureau Director and also the CHP, well, even experts and also private doctors have been telling us that for foot and mouth disease and influenza cases, there is a direct reduction in the number of cases. So other than the ban on group gatherings, well, wearing face masks and also washing their hands frequently, in fact, we don't have to face the situation whereby there might be an influenza outbreak. So should these be kept? So can you just give us a very brief reply? Okay, I'll be very brief. So I'll be asking the HA to answer the question about visiting arrangements. Well, as I said, for the Penny Bay facilities, so they will only be available in around July, and we are actually thinking about the fact that where the situation is easing off, Chunyang Estate might also be released for population intake. We do have new occupants, for example, those returning from Pakistan. They would also have to go into some of these quarantine centers. And what you suggested is on our agenda, because Chunyang Estate should not be used forever for such purposes. But then, given the peak in the spread of the disease, we have no alternative, and therefore, if we have the units available, we will have to see how we can make the best use of those facilities. And also, HA, so several dozen patients scattered into a dozen or so hospitals. So can that be improved? Yes, for patient visiting arrangements, we do understand that lasted for several weeks or several months. And when I read those stories, I also felt heartbroken because there is no alternative, because we have to protect the safety of both the patients and the healthcare staff. And in compassionate cases, for example, those who are critically ill and also for young children, well, in certain circumstances, we would allow family members to visit them, but then we will have to be extremely cautious. So we are already looking into how we can relax the restrictions so that family members can visit patients in the hospitals. In fact, we have been rather flexible already, as Ms. Chen suggested, for some recuperating hospitals. Can we do that first? And also, we are looking at certain hospitals where the situation is relatively calm and the risk is not that high, then we can also relax the control. But then still, the number of visitors and also the visiting time and also the registration system, because we have to do this contact tracing very rigorously. So these have to be considered. But then when will you make a decision? Because many members of the public are very concerned about this. Yes, we will try to do that as quickly as possible, because we have noticed the needs of patients and the public. Yes. Okay, we have several more members who would like to ask questions. Roy Chen, Fernando Zhang, Roy Kwong, and also Xiu Ka-fai and Fernando Zhang. Anyone else? We are asking in the first round. I've already read out your name, says the chair. So Helena Wong will be one of them. Okay. Okay, Chen Hoi-yan and Xiu Ka-chun. I'm not sure if there will be time available. Okay, I'll control the time more rigorously. So 4 minutes, including both questions and answers. Ray Chen. But then in the first round, they've been given 9 minutes. No, just 4 minutes for the question. But then the Bureau took a bit longer than expected to answer the question. They were rather long-winded, but then they were still addressing the points made by members, and I think that's very important, because those are things that the public would like to know. That's why I allowed them to complete their answers. Or else if I just cut them when the time is up, then they will not be able to answer any question at all. Okay, I'll finish my question in 4 minutes, and my questions are very important, and many members of the public would also like to know the answers. Okay, according to the message released by the administration, is kind of contradictory, because this morning, the Bureau Director said that we will have to go back to some normalcy, and then for the ban on group gatherings, you are relaxing that. But then if you look at Lazy Lion's API this morning, they are still asking people to stay home for dinners, and there should be less group gatherings with friends and relatives and so on. And they said that for the purpose of protecting yourselves and others, you should reduce the number of social gatherings and so on. So that gave the impression that the administration is still trying to restrict gatherings. So even with the ban on group gatherings and even with mask wearing, so we should allow people to get back to some normalcy when it comes to social gatherings and so on. So you're saying that you're still asking people to stay home and not to have social gatherings. Then I will have to be very cautious when it comes to such activities. And also on the enforcement of the prohibition on group gatherings. And last week, I already asked the Bureau Director, and she said that she was not sure about the situation. But then ultimately, you will have to be held responsible, because for the restriction on business operations and so on, all these have to be drafted by the Bureau. So, Bureau Director, please pay attention to that. On the enforcement of this ban, has anybody abused the powers? Yes, it has been relaxed from 4 to 8. But then the fact is, even if you are alone, you are still being prosecuted, or you are still given the FPT. So there will be many problems. So you said that self-discipline is very important. I agree. But then if Hong Kong people have to exercise self-discipline, there is no need for you to introduce a law on mask wearing. I would have agreed that there should be this restriction so that everybody would be required to wear a mask when they are taking public transport. But then you said that you can rely on self-discipline. But then when it comes to the prohibition on group gathering, you are actually referring to criminal law and criminal code, and you're actually fining people so that nobody would dare to do this. It's no longer about self-discipline. So for 10 people gathering together, even if they wear a face mask, it's still very risky. But then what about people or 8 people gathering together to have meals without face masks? And also Para 40 also said that if they have been reminded repeatedly, and if anybody tried to test the law, then they'll be prosecuted. So apparently there should be the initial steps of reminding and also alerting and warning before taking up prosecution or imposing a fine. And also many people have asked under what circumstances will you be lifting the ban? Well, you gave a very short answer. You just said that so long as this, you would be monitoring the situation closely. All right, if we have isolated cases of imported infections and so on. Okay, what is going to happen to this ban? So for how long is it going to last? Because if you do not lift them, so you said that people can go back to some form of normalcy. Well, let's forget about the inbound tours and so on. Nothing can be back to normal so long as the ban is still there. Well, in fact, for what we have been doing, other than the initiatives to fight the pandemic, yes, from time to time we still have some confirmed cases. So that's about quarantine and testing and so on. So we will have to step up our measures. So it's about how we look at the current situation with the laws in place, and then by the time when the ban expire, what are we going to do with them? And we said that gradually, if the situation has stabilized, then we will be relaxing those controls stage by stage, and the extent of the relaxation would also have to be considered. So that's our work, and that's the focus of our attention right now. And of course, we would also have to evaluate the risks and also the acceptability of the public and also the overall economic development. So these are the main considerations. In a nutshell, does it mean that so you're still telling people to stay home as far as possible and they should reduce social gatherings? Is that right? Well, the purpose of the law is to reduce social gatherings, and therefore reduction of social gatherings is something that we hope that we can achieve. Okay, Helena Wong, I have several questions, Madam Chair. I'll be brief. First, on the visiting arrangement for hospitals, under what circumstances will the administration and DHA consider relaxing those rules? For example, if family members have already worn a face mask and they've already taken protective measures, then can that be arranged? So can they visit their sick family members in the hospitals? So she's asking for a short reply. So can you give a short answer? Under what circumstances can they visit their sick family members again in the hospital? Yes, HA. Well, a simple reply is that if the situation keeps on like that, that is no local infections and there is no special outbreaks in hospitals and so on. In fact, we are already considering that. But then, as I just said, as to how we are going to manage the risk, how many people will be allowed in. So for how long would you need? So we'll do that as quickly as possible. In fact, we are already discussing that. So for if for 28 consecutive days there is no local infection, then you will be lifting all those restrictions, right? Well, we are already considering the operational arrangements. So we are directly considering how we can operate under those circumstances. So please be quick. Next is about stage 2, the anti-epidemic fund. And for catering establishments, according to their sizes, some 0.25 million to $1 million can be given to them. So I have received some complaints. The operator is, in fact, not the license holder. So you're actually telling you're actually saying that only the licensee would be eligible. The situation is that there are some operators who are not the licensees, but then they're directly hiring the workers and staff. And as a result of the current arrangement, they will not be able to pocket the money, and they'll be the victims. So you will have to consider an alternative way of doing this. So are there remedies? Bureau Director, I'll defer this to the FEHD, because it's the FEHD which is responsible for the distribution of the handouts under the fund. I've already written to you, Bureau Director. I've also written to the FEHD. I've received no reply. So can you pass that on to the relevant colleagues, because it's about the catering establishments, bosses and their workers. They've been coming to us for complaints. Next is about Chinyang Estate. You know that I've also tried to meet you, because we had the charter flights from Pakistan taking people back from Pakistan. And if you are evacuating people and when they come back again, so if you have people leaving the flats, and then would the flats be cleaned up again, because they can see that there are a lot of insects. So would you be cleaning the units before they are occupied again? And there is no air conditioning whatsoever, and there is only one fan. And with a family of 5, it's very hot. And also for the food items, for the ethnic minority groups, they are Muslims, and yet you're giving them ham and cheese sandwich. So you're actually asking them to not consume them at all. So how are you going to deal with that? Air conditioning and fans and so on. And you should also respect their religious beliefs, and you should not be forcing them to eat what they are not supposed to eat under their religious code. Well, in fact, I've received information from Dr. Helena Wong a couple of days ago, and please allow us time to deal with that. For cleaning, definitely after the 14-day quarantine, we will definitely completely sanitize the units before they are occupied again. And then on food items, the CHP would be monitoring closely as to the operation of these quarantine units, and also they would also look at the needs of the occupants and try to respect their needs. For example, they would look at their religious backgrounds and other backgrounds to see what food would suit them or not suit them.
嗰個問題咧就係關於除咗食物清潔風扇。
What about the fans? You said cleaning would be completed 14 days later, but if there's still trash after the cleaning, it would be unacceptable. At quarantine centers, hotlines are available for people staying in the units. They can call the hotline anytime. Well, they did call the hotlines, but there was no answer. For people who don't eat pork or spicy food, then the answer was that there's nothing we can do, and they had to wait 2 days. The issues have been dealt with. Thank you. Dr. Fernando Chang. The epidemic is beginning to ease to our delight, and certain premises have reopened. It is important to encourage the public to continue to wear masks. And this is a lesson we have learned from different outbreaks. If people stop wearing masks, the epidemic could return. That was the case for the Spanish flu and the serious influenza in San Francisco. Certain people with special needs might not be able to put on a mask, including my daughter. So face shields and other protective equipment are also important. I understand, Polly, you designed a face shield. So I hope the government would consider face shields instead of only face masks, and they could be used by frontline workers. In the US, Canada, and UK, they saw outbreaks in their care homes, so we are very fortunate. A lot of care homes in Hong Kong are cramped. I hope you would continue to monitor the situation at care homes. You cannot afford to slack off. Many care homes in Hong Kong employ imported workers, including mainland workers, so you must continue to observe strict requirements. If we slack off in terms of immigration control or the 14-day quarantine arrangement, the epidemic can return. It's clear that the new cases are mainly imported cases. If we slack off, then all our efforts would be in vain. This is not about politics, it's about lives. Secretary? In terms of face masks, we stipulated in the regulation that customers must put on the mask again in restaurants after they finish eating. We agree that care homes are vulnerable places, so we have sent in letters to RCHEs or RCHDs reminding them to remain vigilant. If staff or tenants exhibit any symptoms, they must seek medical advice as soon as possible or receive tests. If there's an outbreak at care homes, we are also prepared. The Department of Health and Labor and Welfare Bureau have compiled a response plan which stipulates how an outbreak can be managed. We are monitoring imported cases. At the airport, we test all inbound visitors, and they would only be allowed to return to their place of quarantine after results are released. Mr. Roy Kwong. Back then, Carrie Lam refused to close the border. She refused to offer masks in March, and all of a sudden, she announced giving out reusable masks. But there were doubts of transfer of interest, and the contract was worth a few $100 million, and it circumvented our oversight. And apparently there were very complicated relationships between the parties involved. This is the CU mask. Secretary, can you offer professional advice? Well, this is a brand new mask. After it is used for a few times, can it still protect us from bacteria, or would it have to be steamed, as Dr. N. Chang suggested? You said this mask can be washed 60 times. If you wash a shirt for 60 times, it might not be in very good shape anymore. Should we be confident about wearing this mask? Should we wear this mask to hospitals? According to the video, the mask should be soaked, but I don't remember whether the detergent or soap should be used. Or should a disinfectant be used to clean the mask? Can you tell us whether this mask would filter bacteria and viruses, and how can it be disinfected, which style of cooking should be deployed? Chairman, according to the Innovation and Technology Bureau, the mask has an ergonomic design and it contains 6 layers, and it contains layers with copper capable of immobilizing bacteria, common viruses, and other harmful substances. And in terms of PFE and BFE, anti-flammability and differential pressure, the mask complies with ASTM F2100 Level 1 standard. And it is washable for up to 60 times. So you should give justice to Dr. N. Chang. Of course, I don't agree with steaming this mask. Chairman, this is something I do not agree with you. In the gist, it can filter bacteria and viruses, and it can last 60 washes. But I don't think it can last beyond a few washes. Apparently, the filtration capability would not be affected after 60 washes. I understand the ITB would invite experts to explain the situation. So I hope they would offer explanations so that the public can have a clearer picture. I have another question. Would there be a version 3.0 to the anti-epidemic fund? Our focus now is to deal with the cash payout under AEF 2.0 and the outstanding work. Mr. Wuchiwai, thank you. For the Shenyang Estate Quarantine Center, it involves a lot of residents waiting to move in. The Secretary said that even the new quarantine center at Disneyland would only be in place by June or July. In other words, do you have plans to gradually vacate Shenyang Estate to facilitate the next population intake? And if so, is there any timeline? You identified a hotel for use as quarantine center, and it will replace the temporary test center at Asia World Expo. In order to facilitate the intake of population at Shenyang Estate, would you pursue the option of using a hotel? And I don't know whether the Disneyland hotels have good business. If so, then it's natural that they rejected the government's request. But hotel occupancy rates should remain low nowadays. And the government, as one of the key shareholders, why would Disneyland refuse to accept the deal by the government? And Disneyland could be paid as well. Disneyland should at least provide an explanation. They sought a lot of funds from us. They should explain why they turned down the business. Thank you. Well, the final question is really a mystery. The government provides the land and money for the developments, but they are refusing to provide their hotel rooms for quarantine. So I'd like to understand their justification. In terms of Chunyang Estate, which is a quarantine facility, like we just said, some of the quarantines are under preparation. For example, at Penny's Bay, it will be completed by July. It will provide 700 or 800 units. We know that many people are waiting to move in Chunyang Estate, so we hope that it can be vacated as soon as possible to allow the waiting residents to move in. Our general considerations are based on the epidemic. The situation has somewhat stabilized. Going forward, we will have new quarantine facilities, and we would certainly speed up our work. This is all part of the plan. As for the Disneyland Hotel, there are views calling for hotels to be used as quarantine centers. The Department of Health, EMSD, and our engineers looked at a number of hotels before, but they found them inappropriate as quarantine centers. The hotel would be used as a waiting center for people pending test results. Has this been discussed? Have you discussed the matter with Disneyland? Did they refuse to rent out their hotel rooms, or is it that you found the venue inappropriate? In terms of the use of hotels as quarantine facilities, we had our reservations, especially at the earliest stages. There would be issues such as disease control or ventilation.
Wu Chi-wei, any follow-up? Well, in fact, it's very simple because there are many ways available. For example, you can increase the spacing in between and so on. Well, Disneyland has 3 hotels, so I was finding it strange. How come they refuse business? Well, I think the Bureau Director has already told you it's not that they did not take it up with the hotel. It's not that they had refused. It's just that they felt that it's not appropriate. All right, you talk about the holding center and that they might need further quarantine and so on. In fact, for the risk that they face, it's not that different because there are also asymptomatic patients who might be there. So that being the case, why can't you consider using more hotels? Well, I think it's the CEDB which is responsible. So, Ms. Law, can you respond? So it's a question from Mr. Wu Chi-wei. So have you taken it up with Disneyland? Sorry, Madam Chair, I don't have the information with me. Okay. Can you supply the information afterwards? Can you supplement it? All right, Secretariat, please take it up. Next, Eddie Chu, last one in the first round. Thank you, Madam Chair. I have 2 questions. First, on the enforcement of the ban on group gathering a couple of days ago, Mr. Lau Chun-to, the former chief editor of Mingpao Daily, also wrote that, well, the imposition of this ban was for reducing group gatherings, is not for the fight of the pandemic. In fact, for some 700 days since last year, all right, in Taikoo Shing and also in Tuen Mun Yuen Long and so on, well, we have had this situation or phenomenon. That is, they are using the common objective as the basis or assessment criteria in considering whether or not they would take out prosecution. It's no longer about the actual physical distance between different people. So that gave rise to a situation whereby even if you, so long as you're in the same shopping center, if they're of the view that you're thinking alongside with others, whether you're singing together, whether you're just there with other people, or even if you're there alone, they would be chasing you out. So Mr. Lau Chun-to, in his article, wrote that if that's the enforcement criterion adopted by the police when it comes to enforcement, so long as you have a common objective. When you go to the Wong Tai Sin temple, even if they are in groups of 4, but then they have a common objective because they are paying worship to the god there. So the police would still be able to enforce the law if they wish. So the prohibition on group gathering, whether it's about the letter of the law and also the purpose of the law, is for the prevention of the pandemic. So it's not, it doesn't have anything to do with any political objective, right? So my question is, in a shopping center, well, under the prohibition of group gathering, it should not be about whether or not they have the common objective being there. An assessment should be made about the distance between these individuals. Let's say if we have 100 people in the shopping mall, so long as there is 1.5 meters between different people and they are on different stories, and if they just sing. So given that situation, in the minds of the Bureau Director, is that against the law? Have they already breached the law? So can you answer this very simple question? Thank you, Eddie Chu, for your question. I think the prohibition on group gathering, the legislative intent is, first, I'll share with you the legislative intent. Well, it's a consideration of public health, the reason why we have to limit group gatherings. Because we don't want the COVID-19, because it's spread by droplets, and we don't want it to spread to other people, and we don't want it to spread in the community. Well, Bureau Director, can you be more direct? The question is, well, there are people who are going to a temple to pay worship to gods, and yet the police would not raid on them. But then when people are in a shopping center, the police would allege that they have a common objective and therefore they should be subject to prosecution. Well, of course, we have different enforcement agents. So enforcement of the law in shopping centers is the police, right? Well, police would be the enforcement agencies. Well, sometimes it's the Department of Health, because including the police and also the smoke control, tobacco control office of the DFH. All right, let's say if there are 100 people in a shopping center, there are 3 stories, and they are 10 meters away from one another. But still, they have been chased away by the police, saying that they have breached the ban on group gatherings. As a matter of principle, so in the minds of the Bureau Director, what would constitute a breach of the law? She has not answered the question at all, Madam Chair. Bureau Director, would you like to respond again? Can you make that clear? Well, the definition. Well, we will have to look at the letters of the law, and the letters are that, well, people would be gathering together for a common objective. So that group gathering is about the 1.5 meters away from one another. So the 1.5 meters distance is the standard. So you're no longer applying the 1.5 meters distance, and so long as they have a common objective, you can just issue them with a ticket. So why would you not apply the 1.5 meter distance in deciding whether or not you'd like to enforce the law and take up prosecution against them? Okay, for the specific circumstances that you are referring to, can you give them the specific situation? Okay, we have 4 more members, 3 minutes each. We'll extend the meeting until after these 4 members have completed their questions. Okay, Tommy Chang, Xiu Ka-fei, Chan Hoi-yan, and so on. Tommy Chang, yes, my question is, well, under the ban, if it's not relaxed, well, I support it to a certain extent, but then The thing is, for some of the bigger restaurants, they have staff. In fact, I've been pursuing this with you. Under the present circumstances, let's say I have 10 tables for my birthday celebration. Is it against the law? Okay, if I only have 8 people in each table, and then I have 10 tables, 20 tables with 8 people for each table, would that be against the law? And if it's a private party, okay, by the time when I hire the venue, so I'm talking about a restaurant, so it's not a private premise. So when you consider this, will you consider relaxing that? Because yes, there might be people gathering, and yet if they only have 8 people at each table, and if there is a distance of 1.5 meters between each table, then that would be room for survival for some of these restaurants. Because without the banquets, on Mother's Day, of course, this weekend would not be a problem. So even tonight, tomorrow, and weekend is not a problem. But then afterwards, restaurants are asking if they can relax it. And what does the sector need to do in order to ensure that they can resume their business? So I think the most important thing is to strike a balance. So you need a balance, and then the sector would also need a balance. So would you impose specific requirements on them, and they are willing to comply? So can you give us an answer? Yes, Bureau Director, do you have an answer? In fact, if we look at the existing provisions, well, the number of people that would be allowed to gather would be limited to 8, and for catering establishments or restaurants, as Mr. Tommy Chan just referred to, so we would allow only up to 8 people at a table. And under 599G, with regard to the common objective gathering, so legally speaking, that's one of the factors under consideration. And of course, just now you said that, well, for some catering establishments during festive days or festive seasons, can we lift the restrictions? Well, we have to look at the circumstances, but then at the next stage, we would be reviewing the situation, and we would take on board your views. Thank you. I'd just like to supplement, because I haven't used up my 3 minutes. I hope that the administration and the other colleagues would consider this. Well, you're just talking about some private parties, and they would not affect our economy. And of course, it's always good if you can hold the line straight. But then, are there any ways that you can relax it somewhat? Bureau Director, yes, thank you. Other than public health considerations, as you can see, we are actually gradually relaxing them so that people can return to some form of normalcy. And we would, overall speaking, the administration would be looking at the economic situation and the acceptability by the public. So we will review the situation. Okay, next, Shiu Ka-fai. Thank you, Madam Chair. I'd just like to ask about the fitness centers and also dance studios. So for the limit of 8, the reason being that well, in some of the private premises, like fitness centers, one instructor might be teaching a class of several dozen. So the cost, in fact, is a very spacious studio. All right, if you limit it to a class of 8, actually these companies would not be able to operate, so they would be forced to close down. Yes, I understand that it's important to fight the pandemic. All right, we have already got the 14-day plus 14 days, and there is no confirmed case. There is 0 case already. And also for these people, I can give you an example. Okay, 8 in a group, and then even if you have 32, if there are 4 groups, and then 8 in a group, and then if there is a distance of 1.5 meters in between, even if you lengthen the distance 2 meters, 3 meters, because you're talking about a studio room of a hut of 10,000 square feet. If you just limit it to 8, then you're actually de facto asking them to close down. And then for restaurants and so on. Okay, what's the purpose? Okay, they are having banquets and so on. Okay, each table can only have up to 8. Okay, if there is a distance of 1.5 meters, then the entire restaurant is operating. So how can you just expect them to have a table of 8? That's not reasonable. You're actually forcing the restaurants to close down. That's not your purpose. And then for fitness centers and also dance studios and so on, so they have such a spacious studio. Why can't they operate? Why can't they have more groups? Yes, when in coming up or formulating policy, yes, is the HA Bureau. Okay, we have already replaced the Bureau Director. So before he left, did he say anything about it? Did he ask to meet you? So who should he talk to? So there are many stakeholders, and they have been approaching me. And this morning, I have had many phone calls from them. So can you reassure them as to what they should do? Bureau Director, are you able to answer the question? Well, let me put it this way. We have to understand that we have already given the instruction. So for instructors, for each group of class is limited to 8. So when it comes to the trade, if they have difficulties complying with this restriction, then we can consider their views, and then we'll review the situation and also whether or not there is any room to maneuver under the existing law. We will consult the D of J, and then we will clarify the situation. You will have to do it expeditiously because today they are allowed to resume business, and there is a lot of confusion out there. Bureau Director, one day's business is very important to them because they are catching up, because they have suspended their business for such a long time, and I think it's justifiable for Mr. Xu to raise that with you. Okay? Can you clarify, Ms. Chen Hoyan? Well, I'll give you the first comment. Just now, some members questioned the CU mask. You don't have to be that mild because it's very factual, because the administration has already provided all the information. So it's in line with the requirements of the US, that is ASTM, that is their favorite or preferred standard. So ASTM F2100 level 1 standard. So if they question the standard, then they can just question the US standard, because they have put it they have put everything on the website, and as to how they can sanitize the mask, you have to use soap and water, and it has to be cold water and so on. And for the reusable mask, before you wear the face mask, you will have to disinfect your hand, because the surface of it can also be infected or can be contaminated. So before and after you put on a mask, you will have to disinfect your hands. That's very basic. So for members who still refuse to understand it, and if you still put in that question to question the prevention ability of this mask, I don't think you need to be very warm with them. And also for the version 2.0 of the Anti-Epidemic Fund, how come they are so thick-skinned in asking you about version 3.0? In fact, Tommy Cheung and his constituents haven't been able to get the funds under 2.0. So you're against version 2.0. So why are you asking version 3.0? Okay, coming back to my question, we are most concerned about the relapse cases. Well, even yesterday we had one, and in overseas countries they also had relapse cases. So I'd like to know. So what's the interval between the two tests? So can you extend the or widen the gap so that it would be tested less frequently? All right, let's say if I had one test tonight and then one more test tomorrow. Yes, I agree that there should be 2 tests, but then what about the interval between the 2 tests? Can you review it? And also, because of the increase in the number of relapse cases, so can you widen the gap between the 2 tests?
Would the HA take this question? Thank you very much. I stress that we did not change the requirements on discharge of patients. That is, there must be a 24-hour gap between the 2 tests. So the time gap between the 2 tests would be at least 24 hours. But the recent scientific evidence was discussed at the DHS Science Committee, and apparently the symptoms of the patients would be even more important, or a more important factor And Professor Yun has often talked about the presence of antibodies. If antibodies are present in the patients, then they are more likely to be discharged. So we are looking at our discharge guidelines and the tests for antibodies. The work is ongoing. Finally, Mrs. Xu Ka-chun. Thank you. Some certain groups in our society are often ignored. They are always at the last of the line, including the homeless, etc. Personal hygiene is very important to disease control. But we have 1,270 people in our society who cannot even take a shower. Some of them don't have a shower for 5 days. This is certainly not ideal. I understand that to avoid gatherings, socialization, and the spread of disease, the FEHD and LCSD close all shower rooms and changing rooms, and as such, the homeless had nowhere to take a shower. That was already reported in the news. And with the easing of the epidemic, many services have resumed. I hope you would tell us whether the LCSD's changing rooms or FEHD's public shower facilities would be reopened for the homeless. Secretary, thank you. We have no representatives from the LCSD today. For fitness centers, some of their shower facilities could be reopened, provided that there are public health measures. For example, there is separation and regular cleaning and disinfection. I understand the LCSD are planning when different facilities can be reopened, including shower facilities. Chairman, the temperature today is as high as 32 degrees Celsius. If the epidemic has eased, you should be more decisive. I hope you could make life easier for everyone. Do you want an answer from the Secretary? We would convey this view to the LCSD, and I believe they are dealing with it. This is the end of the meeting. We have no other business today. Thank you very much.